Okay, so let's talk NCLEX. Welcome back again, guys. Today is Tuesday, and we are here again for another edition of the NCLEX Journey video series. And I'm here to talk again about the NCLEX exams. Guys, I've told you you need to contact me. I've been asking you to contact me. First of all, I want to say shout outs to our nurses back in Ghana who are taking their NMC licensure exams today. I wish all of them the best of luck. I hope that everything, goes on smoothly as possible. Please, as you are watching me, I know you are taking your exams, but let me tell you that the most important thing is you have to make sure you pass these exams, because once you pass the exams and you are registered as a nurse in Ghana, that is when you'll be able to decide whether you want to come to the US and continue your nursing practice or not. Because I mean, if you don't pass the exams, definitely you won't get licensed, and that means you will not be able to come to the US using this nursing, NCLEX part. So I urge all of you, all of our nurses who are taking the exams today, to take the exam very seriously, because it's actually going to decide whether you will be a nurse or not. So thank you all so much for joining me today. I appreciate your time. We all don't have time, but you guys, anytime I come live, you get time to actually join me here, and you all have a great discussions and all that. So first of all, I want to thank all of you. So like, first again, I'm also streaming on YouTube. If you go to YouTube, you just have to search TWAJ and you'll be able to find me on YouTube. I'm also streaming on Facebook. Right now I'm on Facebook, I think on two three Facebook pages. So if you are watching me, you can watch me on Facebook. It's just type my name, Tony Wood, and all the channels will pop up for you to be able to come live. I mean, to join me, and then we can have discussions. So yes, guys, I've been telling you, I've already given shout outs to our nurses back in Ghana who are taking their exams today. I wish them the best of luck. I need to tell them that they need to take time in answering their questions. Just pay attention to whatever the question is saying, and then come out with the best possible answer. Because if you don't take your time, sometimes when we are answering questions, we tend to hurry through the questions. Sometimes due to some information we read somewhere, anytime we are sitting for exams, because of the information that we had before we are taking the exams. It's like sometimes if you don't take care, you might see certain information in the questions, and you will be rushing to go and pick some answers, which at the end of the day it will not be the right answers. So please pay attention to the question. What is the question actually demanding from you, so that you'll be able to come out with the best possible answers? Because the nursing exams, all the possible the MCQs, they are all correct answers, but you are always asked to choose the best one, okay, out of the, I don't know how many options they will be giving you, whether A, B, C, D, or E, whichever the case may be, you should be able to, give the best, answers. So please take your time. This is not the end of the world. This is a journey that you have started. I know you started from school, level one, level two, level 300, and here you are able, you are going to, take the test. So please pay attention. Pay attention to the question. Pay attention to whatever they are demanding from you. I don't. I think that it's not a difficult, question. It's not difficult task, but I know at the end of the day, those who are going to pass will pass. You know what I mean? So I wish you all the best. I pray that a lot of you will pass. We will have a lot of you passing the exams. So that is it. But now let's come back to action. Let's talk about the NCLEX exams. I've been telling you. So if you are watching me, just share the video, follow me, and let's talk about the NCLEX exams. Let's talk about NCLEX. Let's talk about NCLEX. So I've already, in my last two videos, I've talked about the NCLEX. It is an exams for all nurses in Ghana. Sorry, in the US. When you pass your, when you finish school and you want to become a nurse, you have to take this exams called NCLEX. Okay. It is called National Council Licensing Examination. National Council Licensing Examination. National Council Licensing Examination for registered nurses. So when you see NCLEX RN, that is for registered nurses. And then we have National Council Licensing Exams or examination for practice nurse. In the US, we have two category of nurses. We have practice nurses and then we have registered nurses. So that is the difference between the two. They don't take the same exams. There is the NCLEX for nurses and there is an NCLEX for, practice nurse. So the kind of education that you take will determine whether you are going to take the practice NCLEX, exams or the register nurse NCLEX exams, and it's simple as that. So if you are trained as a practice nurse, then you take the NCLEX PN exams. If you are trained as a registered nurse, then you take the NCLEX RN exams. So that is it. That's basically the difference. So I've been telling you guys, if you are interested, if you have already passed your NMC exams, you have registered as a nurse in Ghana, you've started working, and you need to come to the US. This time you have decided to join us here in the US. You only have to just contact me. It's not a big deal. Just contact me and I can help you to actually move to the next step. I mean, I will guide you through the processes so that you'll be able to also, come here and continue your nursing career. So basically, that is all that I've been saying the past, 2 weeks. Anytime I can live, I've been talking about these exams. So if you are watching me, just share the video. Maybe there are couple of nurses who are not following me, who are not my friends on Facebook. If you could, share the video to them, maybe they can decide to take the journey, because you don't know. I know some of you are not interested, but I will be very, very grateful if you guys, those of you who always, watch me to, I mean, share my videos to them, so that if they watch my video and actually come to a conclusion that they would like to take this journey, then they can contact me and then we can take from there. It's just some few processes, like I said. I will be, interviewing you, asking you some questions here and there. I would like to know how long you've been a nurse, when you had your nursing license, which facilities you are working, and then we will take from there. So that is it. So please follow me. This video today, I'm not going to take a very long, time. I'm not going to stay here for a very long time. So please spread the message. Let people know what I've been preaching about, what I'm talking about. Like I said, I have few Facebook friends. The number of people I have on Facebook are few. So sometimes when I come live, it is those who are friends with me on Facebook that get to hear about my message. So if you are watching me, you can share the video. You can let your sisters, your brothers, any nurse in Ghana get to know about this video so that they can contact me and we can take from there. So like I said, I'm going to guide you because we have been here. I've been here in the US like 3 years now, and I've been doing nursing since. So I'm a little bit, experienced. So please, if you hear this message, you can be in Nigeria, you can be in any part of Africa. You can contact me, you can follow me on Facebook, and let's, have discussions on this issue. Let's have discussions on this issue, and then I will be able to guide you through all the processes. Because, like I said, I'll be answering your questions. I'll help you to write your CV. You need to write a CV in a way that will be acceptable here in the US to most of the nursing agencies. So we will guide you. I'll guide you through all of these processes, and then we can look for an agency for you so that you can also begin your nursing journey um, from wherever you are. You can be in Nigeria, you can be in Kenya, you can be in Sierra Leone, you can be any part of Africa. And if you only if you are a nurse, you can contact me, and then we can take it from there. Because I'm going to guide you. I'll guide you. I'll help you to write your CV, and then we'll look for an agency for you to actually begin the whole processes. So those of you who have just joined, please let me hear from you. Type something in the comment, and then we can continue from there. Please let me hear from you. Let me hear from you. When you can, please type something so that I'll be able to know who is live with me today. I don't know who is on now, but if you are watching, please let me see you. Um, let me hear from you. So, like I said, the past few weeks I've been talking about NCLEX, 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 NCLEX. Please, if um, if you want to move step ahead, you want to actually come to the US and then continue your nursing career. Yo, Mr. Entry, thank you so much for liking the video. If you want to move ahead, please, like I've been telling you, contact me. I'll guide you and help you through all the processes. So let me hear from you when you joined. Um, I'll be grateful. Those of you who are live, I've seen like 2 people live now joining me right now. Please type something. Let me because I'm streaming from desktop computer, so I'm not able to see those of you who are live. I'm streaming on desktop. So yo, Emmanuel, thank you so much. Thank you. I've as for you, anytime I come live, you are always here. Thank you so much. Please, yo, Ima. Yeah, I see you too. I see you. How's everything in Ghana? I hope You guys are doing great. I learned today a lot of nurses are taking the NMC licensure exams. I just want to take the time to wish them all the best because I know nursing exams is not easy, you know. It is not easy, you know. So I wish them all the best. Like I started this video, I've been telling them to actually take their time, make sure they are answering the question. They actually understand the question before they choose the best, you know, answers. So I know they will pass. Lot of them will pass, and some of them are going to fail because there is no examination that you get 100%, you know, um, pass. I mean, all the candidates passing at the same time. I know there are some who are going to fail, but I mean, that's not the end. If you write an exams and you fail, I think you need to go back and just reaccess, do a little bit of, you know, reflection and see what you did right and what you didn't do right, you know, and then try to do some corrections here and there. And I think at the end of the day, when you go in the second time, you might be able to pass. So that is it. That is it. So if you are joining me, we are talking about NCLEX. So I've already explained there are two examinations here in the US um, that people who have gone through college or university they take. It's either the practice nurse NCLEX exams or the registered nurse NCLEX exam. So depending on which course you took at university or college, it will determine which type of NCLEX exams that you take. So please, right now I am focusing on the NCLEX registered nurse exams. Yeah, NCLEX RN exams. So if you are a nurse across Africa, you can be in Nigeria, you can be in Kenya, you can be in Sierra Leone, I mean, any country in Africa, if you are interested, if you watch me on Facebook, if you watch me on YouTube, if you are watching me, I mean, you can contact me and then we can take from there. I will guide you. I'm going to guide you, help you to write your CV. I will guide you how to answer your, you know, questions and all that, you know, answer your interview question because when you get an agency, they will be interviewing you, you know, they will interview you before they sign a contract with you. So please, this is what I'm going to do for you because um, because you don't know what these agencies are looking for in the, you know, in these international nurses. I mean, in you, those of you in Ghana, because you don't know what they are looking for. We are experienced, we have gone through the system, and we know what they want. We know what they need from these international nurses, the kind of qualities they are looking for. So when you contact us, then we can sit down. We will ask you when you completed so the facility that you are working right now in Ghana, where you are working. We would like to know all of this information from you and then take it from there. And then we will guide you and then you write your, you know, CV, a very, very um, high standard, you know, CV. And then we can apply to these agencies and um, we will continue from there. So this is what basically we are going to do for you. But like I said, let me tell you guys, it is not going to be free. You know, we are going to charge this side. Those days when we came at first, we were like, "Oh, let's help you." We're doing this for them. We are doing no. This time, we need to use our time properly. Our energy should actually yield something for us, a little something for us. You know, so if you contact me, you are going to be charged. But please don't forget about the charge. It's just a little amount of money for me to buy data here and there so that I'll be able to also come live every day and do what I'm continuing to do what I'm doing. But The point is, forget about the money, because I mean, if I charge you 1,000 Ghana cedis or 500 Ghana cedis, it's nothing, you know. At the end of the day, what I want you to succeed. I would like you to see you in a few years to come. You also be able to come to the US. You'll be able to relocate and then come to continue your nursing career. This is what I'm looking for. I want to see a lot of our nurses here in the US, nurses in Ghana, a lot of you in the US. So please, um, if you are ready, just contact me and I'll be able to help you. Today, like I said, we are not going to spend a lot of time here. I'm just here. It's almost like 20 minutes that I started this video. So please, I'll be like, I'm waiting for your messages. As for Facebook, you go to Facebook Messenger, you can send me a message and then I'll reply you, right away. So um, I need to thank all of you for your time. Those of you who are watching, please, I just want to see you guys on live right now, joining me right now. Just say something, because I see Emmanuel Ofori. He typed something a few minutes ago, and I've acknowledged him um, already. So if you have just joined, just say something, and I'll be able to see you, because I'm streaming on a desktop computer. I'm streaming live on desktop computer, so um, I wouldn't be able to know who has joined. So please say something. So um, yes, so that is it. I'm not going to spend a lot of time today. I'll be going off in a few moments. So like I said, if you are interested, if you have a brother or a sister, or a nurse um, who is interested in relocating to the US, we are here to guide you guys. We are here to guide you guys. Just contact me and I'll be able to help you. So thank you so much. I'm here. I'm not going to spend a lot of time. So we will see you in the next video. I'll come live some other time. But um, it will be bye-bye for me here. So please follow me, share the video, and then let all of our brothers and sisters, all of our nurses, colleague nurses in Ghana who are interested to contact me. I know today some of you are taking the NCLEX exams. Sorry, NMC exams. Yeah, I wish you all the best. I wish all of you the best of luck. I know you are going to pass. Okay, you will pass. So keep on studying. I think it's going to be. I don't know these days how the NMC exams is like. Those during our time, it was like 5 days, Monday to Friday, because we were taking various subjects. Um, I remember you do medicine, you do pharmacology, you do psychiatry, you do what do we call it? Midwifery, you do what else? Surgery. So it was like every day we were taking two papers. So it took us like 5 days, Monday to Friday, before we completed, the um, the NMC exams. But I learned that now they've moved everything to it's computerized. It's computerized, based exams, just like the NCLEX exam. So I'm sure it's going to be like just one day, just today, because if it is just today, just computerized, based exams, then it will be just today. So I wish you all the best. It's just like taking the NCLEX. It's just one day. NCLEX exams is just one day. You'll be answering 150 questions for, I think, I don't know the hours now, but during our time it was Was it 6 hours or 5 hours? Probably 6 hours. I don't know. So I wish all of our nursing uh, candidates, examination candidate, NMC licensing, examination candidates, those who are taking their exams today, I wish them all the best. All the best. I wish that all of them will pass, but I'm sure that will not be the case because I'm sure there are some of you who are going to fail. I'm not saying you who is going to fail, but whatever the case may be, I'm sure it is not going to be 100%, pass. Some of you are going to fail, and that is how it is. It is nature, Um, there is no examination where you have all of the candidates passing at the same time. But I know a lot of you are going to pass. So let's say 90% are going to pass. Yeah, 90%. Because I saw on the NMC Facebook page, and it's like about 7,000 plus nurses who are, taking the exams. So 7,000 plus. Let's say we get about 6,000 passing the exams, 6,000 candidates passing the exam. And I think that would be a great news because, I mean, if you have 7,000 nurses going to take exams and out of the 7,000, 6,000 are going to pass, then I think it's a great news. So, guys, thank you so much. Here in the US, it is what is the time? It is almost 12 p.m. It's still morning because it is 11:58 a.m. right now. It's still morning, so almost 12 p.m. here in Texas. So um, I want to thank all of you, those who just joined. If you have joined, please type something, say something to me, so that I can acknowledge you. You know, because like I said, I'm streaming from desktop. I don't know who are who have joined. So thank you so much for your time, and I wish you all the best. Whatever you are doing, do the right thing. As long as I want a lot of you to come to the US, I also would like to encourage all of you to do the right thing when you go to work. Do the right thing. I mean, let's uphold nursing in Ghana. Let's uphold in the same way you want to come here and do the right thing. You have to start in Ghana. You know, you have to start doing the right thing. Go to work early. When you go to work, you have to serve your patient in a way as you have promised. Okay, the Nightingale promised that you took. The oath that you took when you were getting your registration as nurses. You have to uphold that oath and then serve our people. You serve Ghanaians, in a manner that um, is expected of you as nurses. So that's what I'm saying. I know a lot of you um, wish to be here in the US. It is everybody's dream. Some of you, your dream to be here, because I know that we have nurses in Ghana who would love to stay in Ghana. Yes. So anytime you go to work, you have to make sure you put out the best. You serve all of your patients uh, faithfully. You serve them faithfully. You will. I mean, you uphold the standard of nursing practice. Okay, you do the right thing. You serve them faithfully and with your whole heart. Because we also need to make Ghana a better place for all of us. You know, in as much as you want to come here, since you haven't, since you are still in Ghana, you haven't left. Please, I will encourage you to do the right thing when you go to work. You know. Um, thank you so much. I will see you in the next video. And I need you to share the video and like my page. When you come here, please follow me so that anytime I bring NCLEX news, you'll be able to get all the information. I want to thank you so much. If you have any questions or you are in doubt of anything, please just send me on message on Facebook, and I'll be happy to answer your messages or your questions. I have my WhatsApp number in one of my previous, videos. Just go there and pick the number and save it, and then you can WhatsApp me. I want to thank you. Thank you so much. Let's grow this page together, especially my YouTube page.